Great. And I think I was able to successfully enable closed captions. So if anyone does need that, I think if you go to more, there's an option for closed caption or for captions, and then you can select that and it should then show up just on your screen, I believe. So hopefully that works for folks. So I'll start by just introducing myself. My name is Catherine Cheston. I'm the Director of Community Action Groups Oxfordshire. We are a network support organization to mostly volunteer-led community groups across the county, although we do have some social enterprises and socially trading organizations in our network as well. And I will also let Laura, who is co-hosting with me this evening, introduce herself.
Thanks, Catherine. Hi, everybody. I'm Laura Price. I'm Chief Exec of Oxfordshire Community and Voluntary Action, or OCVA, and we're a support organisation for the community and voluntary sector across Oxfordshire. So we provide training, advice and support to setting up and running any kind of not-for-profit organisation. And we also run an Oxfordshire-wide volunteer centre, so matching charities and organisations with people that are looking for volunteering opportunities.
Excellent. Thank you, Laura. So we have a couple of speakers, and just in terms of the flow of this next hour and a half, a couple of speakers and presentations, and we'll do a short kind of panel Q&A, and then we'll go into breakout some rooms so we can hear from you all and get a bit more of sort of, yeah, what you all are thinking about in terms of climate and public health and how we move these two things together jointly and in a more sort of integrated way. So I will first turn it over to Rosie Rowe, who is going to walk us through the report and really sort of the thing that kind of, spurred this conversation. And I think it's a really, if you had time to read it in advance, a really interesting report and definitely sort of lays a pathway for how to bring these things together and sort of why. So without further ado, Rosie, I will turn it over to you and I will try and pull up your presentation.
Good evening, everyone, and thanks very much to Catherine and to Laura for co-hosting this conversation. I really welcome the opportunity for talking to everyone this evening. And I have to start with an apology, which is from Ansaf Azar, who is the Director of Public Health. He was initially scheduled to be giving this presentation, but he's on paternity leave. His wife had their third baby 2 days ago, so he can't be with us. He's in a very important other place. So you've picked the short straw with me, but I'm the head of Healthy Place Shaping in the public health team at the County Council, and as part of my remit, I have the climate action scope and remit within and responsibility within my role. For public health. And I also wanted to introduce Sarah Gilbert, who's also on the call, because this has been very much a joint endeavour between public health and the climate action team. Sarah, do you just want to introduce yourself? Oh, we're not hearing any sound, Sarah. I don't know if you've got if you're on mute. No, it's not. Okay, so I think Sarah's going to leave and come back again. And so while she does that, I will move on to the first slide if I can. I'm happy to take questions as we go, but it may be easiest to do it right at the end of the presentation. So can we go to the next slide? Lovely. Oh, nope. If we can go back, that's one. Go back one, please. Lovely. So the Director of Public Health's annual report is is not like an annual report in terms of reporting on activity that public health has been doing in the last year. It doesn't take that format, certainly not in Oxfordshire. What we use it for is to shine a spotlight on a particularly important health issue. And in the past, we've looked at the issue of health inequalities across the county. Whilst there are very good health and well-being outcomes for a lot of the population, there are areas within the county where actually our health outcomes are really, really poor. And so that report highlighted that. There was a report last year which was looking at the whole systems approach to developing a healthy weight. And this year, we decided that actually the focus needed to be on climate change and health, because whilst we're obviously very well aware of the climate emergency, very little is talked about in terms of the impact of climate change on health, not just on global health, planetary health, but also on the health of Oxfordshire's residents. So the work that we do to generate the Director of Public Health report is a technical report. It tries to pull out really local information to Oxfordshire to explain how this significant health threat and challenge is impacting on people's health, on the use of services, and ways that we're trying to address that and mitigate it. And fundamentally, it's a call for action. It's a way of asking everyone, so that's the NHS, district and local councils, but also importantly, the voluntary sector and local community groups to come together to address this really important challenge. If you're going to have a look at the report, you'll see that it ends with a series of actions, and so we will come to those in a minute. And I'd particularly also like to recognise the contribution that a registrar, so we have a series of registrar trainee public health doctors who are on rotation with us, and Louisa Chensiner was the registrar who did a lot of research and writing behind the report, and she definitely should be credited for a lot of the information. Which is unusual because often we don't have local health information about climate impact. So we are really trying to break new ground in Oxfordshire by having a focus on this subject area. And we're calling it Healthier, Cleaner, Faster, Climate Action for Health in Oxfordshire, because we do need to be doing things faster and quicker and in a more expansive way if we're going to address the climate change and the threats to health. So next slide, please. So what prompted us to look at this topic? Well, a number of reasons. And I think over the course of the last year, a groundswell really developed around starting to talk about climate change and health. And in a way, it's been a kind of missing narrative around all the sort of climate action work. Sometimes it's been referred to in terms of co-benefits, but very rarely has there been an absolute focus on it. Whereas in 2023, there were a series of initiatives that really tried to encourage people to identify the impacts on health and well-being. There were a number of articles in scientific journals. The Lancet, for example, brought together 200 journals calling for health professionals to recognise the impact of climate change and biodiversity loss on individual health and wellbeing outcomes, and also to recognise that there were real health benefits to taking action to address climate change. And that culminated in the first COP. It only took 28 years, but we finally got there. There was a focused, dedicated day on health and well-being, and resulting in a health declaration. So all of those initiatives are sort of some of the reasoning behind it, and also the provision of increasing information about the impacts of how climate change that's already happened is impacting on our health and well-being in Oxfordshire. And I'm going to pass over to Sarah now, who will also describe a little bit about those climate change impacts.
Thank you, Rosie, and thank you for bearing with me with my slight audio problems earlier. Thank you very much. Could we go on to the next slide, please? I'll just briefly actually introduce myself. Rosie talked about our sort of partnership working across the organisation. So my name's Sarah Gilbert. I work in the Environment and Place Directorate in Oxfordshire, and I'm Head of Climate Action. So this will be very familiar to people on the call, that climate change isn't a future problem. It's a problem that's affecting Oxfordshire now. And I think what's quite striking about this graphic, and I'll give a bit of a description of what the graph's showing, is how quickly temperature rises are accelerating within the county. So this graph is showing the changes that Oxfordshire is already experiencing. The red graph show a year that was hotter than average. The blue graph show a year that was cooler than average temperature. And the little dotty line that is a little bit hard to see is showing what's happened to temperature in Oxfordshire since pre-industrial time. So we now think we're at approximately a 1.5 degree rise in temperature, but with a max temperature that's about 2.3 degrees above pre-industrial times. And the challenge for us, and of course a lot of my team's work, a lot of people on the call be interested in work around meeting net zero, and that's absolutely an imperative for us. But what we're going to have to do as communities is deal with this carbon burden that's already in the atmosphere and is going to increasingly affect our climate as we go forward. One of the things we looked at when we did a vulnerability assessment for Oxfordshire is what potential temperatures might look like in the period up until the 2050s and into the 2080s. And we're looking at average summer temperature rises of between 2.5 and 8 degrees. Can I have the next slide, please? But of course, whilst we're all going to experience some of the effects of a changing climate, not everyone is going to have the same level of vulnerability to these effects. And there are many factors that obviously influence whether people are vulnerable to things like flooding and the effects of extreme heat. Some of those are quite well documented, and there's quite good data sources on, so the Environment Agency's flood maps, for example, but other factors such as people who live in high-rise accommodation who are more likely to feel the effects of heat, demographic differences where we have communities with particularly elderly or particularly young people, really start to help us look at where within the county might have particular vulnerabilities to climate change issues. So this sort of slightly busy document is showing us on the left-hand side heat risk, and on the lower axis flood risk, and what it's mapping across those is our wards in Oxfordshire, and the size of those dots is the scale of that community. So this vulnerability assessment is taking into account both those geographical factors, but also all those influences of our community that are going to make them more vulnerable to these effects. I think this data is really interesting. There's a high correlation with some of our areas that will experience extreme heat with deprivation, which obviously brings additional challenges to those communities. And as we increasingly experiencing rising temperatures, obviously more communities are going to fall into that upper tier unless we're taking preventative action to stop that being the case. I think it's also worth raising that, of course, this isn't only sort of residents' homes that are of interest. Rosie talked about the health community, and we've got 9 out of 10 UK hospitals, including hospitals in Oxfordshire, that are susceptible to overheating because of their design, particularly. I'll hand back to Rosie.
Lovely, thank you. So Catherine, could you move to the next slide? So this report, as well as being developed with the support of Sarah and her team, had a lot of input from a very wide range of organisations, from the NHS, other district and city councils, and environmental action groups, as well as our 2 universities. So it definitely is a piece of partnership working that hopefully will be useful to all those partners who are involved. Next slide, please. And if you just click through to these, for those who haven't seen the report, this is its basic structure. So we've got an executive summary, an introduction, and then a section on why we're looking at the impacts of climate change on health, a section on what we're doing to address them, and then the final section, which is a call to action. Next slide, please. And the introduction, it really sets some of the key messages that I want you to really be aware of and to inform others about. That fundamentally, health is the untold story in the climate emergency, and for too long we haven't brought health and health issues together with climate concerns and climate issues, and we really need to do that. We need to do it because of obviously the threats and challenges to health and well-being outcomes, and we'll come on to those. But as important is that actually, if we take climate action, it results in immediate and positive health benefits to individuals and to communities. And those benefits are felt now. Often when there are discussions about climate action, we talk about reaching targets in 2030, 2040, 2050, those kind of long-term timescales. But we know from a health perspective that though the benefits from taking climate action measures produce benefits for individuals pretty much immediately. And that's quite a game changer in terms of talking to people about what might motivate them to change their behavior, or to travel differently, or to choose to eat different foods, or source supplies from different places, because those benefits will be felt really soon. And as the slide shows, it's better health for everyone. I think younger people are obviously very well aware of the impacts of climate change that's going to be on their lives, but that it's equally true for people who are in older life, and particularly in later life, who may have health conditions already, which makes them particularly vulnerable to the impact of climate change that's already happened. So in this way, it really has major benefits if we talk about climate and health together as one narrative. Next slide, please. So the way that the report is structured, it looks at the impacts of these sort of 5 key elements in terms of how climate change has impacted on them, and how that then impacts on health. And I'm going to briefly run through these, and then if you want more detail, then obviously you can go to the report. So next slide, please. So obviously, for those people who've been maybe enjoying slightly more seasonal, warmer weather, people may feel that actually an increase in temperatures is not always a bad thing. But we know that actually, for some people who are vulnerable to the impacts of heat, particularly those people who are living in flats, who have long-term conditions, who are pregnant, young children and babies, actually temperatures of 24, 25 degrees C can really raise their risks of health impacts significantly. And by that I mean we're looking at the impacts of potentially on their heart health, on the risks of stroke. So it's not just about dehydration, it's about that having significant impacts on heart disease and heart health. And that's why we know that excess heat can result in deaths. And in 2022 alone, there were 65 excess deaths during those periods of higher temperature. And if you look elsewhere across the globe, in Paris, when they had those extreme heat waves, in Canada, you get a similar pattern. So obviously there's a need to address heat health and trying to reduce the risks to people who are particularly vulnerable. And we've initiated a campaign this year to inform people of what they can do to protect themselves. I think the other thing that Sarah referred to is that the impacts of heat on our sort of institutional settings, so on our hospitals, our schools, GP surgeries, those impacts can be really significant, and obviously it has a major problem for the way the NHS can operate if its estates cannot cope with and aren't adapted to cope with heat. And we know that in Oxfordshire that isn't a particular issue. And we're also a rural county. So whilst the urban heat effect, the map shows where actually areas of our more urban centres are at greater risk from excess heat. But there are risks in the countryside too, and particularly we saw in 22 and 23 the particular issues around wildfire incidents across the county, which almost resulted in a major incident on one day. So next slide, please. We also obviously are very concerned about the impacts of climate change on air quality. And whilst a lot of the changes that are being introduced to get to net zero, such as introduction of electric vehicles, electric bikes, etc., are all helping in terms of reducing nitrogen dioxide, other emissions around particulate matter. So these are these really tiny particles that can get into the lungs and really, again, increase risks for people who have respiratory problems, so asthma, COPD, any other bronchiolitis, those kind of conditions. They will also then result in significant impacts on both mortality, but also on mobility, people's quality of life. And unfortunately, again, those people who are most vulnerable are youngest in the population, so our children and babies, and our older population. So something to really consider. Another fact that we have identified through the research for this report is the impact of higher temperature and pollen, and how that has impacted in terms of development of airborne allergens, and significantly increase that, which results in real exacerbations for people with respiratory conditions, resulting in lots of calls to the NHS. One of our emergency doctors talked about during that period last year in June, when pollen was at its highest, literally having a bucket of inhalers that they were giving out to people as they came into ED, experiencing the impact. So it's obviously really concerning, the impacts on individuals, but we also have to consider the impacts on our hard-pressed NHS as well. And next slide, please. Water. So water's obviously been very much in the news, both in terms of cleanliness of the water and also problems around excess water and flooding. And Oxfordshire is not immune to that by any means. Everyone will remember Storm Henk earlier this year, and obviously again there are certain parts of the county, in Abingdon, parts of Oxford, Witney, which are at particular risk. And there are the health impacts to that, the stress, the impact on mental health and well-being following a flooding incident, and then the sort of low-lying anxiety concern once you have experienced flooding is a significant factor. We also know that contamination of water is a real issue, both in terms of reducing opportunities for physical activity. Only 1 out of 8 of our recreational river sites had clean and safe water when they were sampled in 2021, and obviously the risks of picking up pathogens if you exercise in dirty water is a major concern. So again, the higher temperatures will increase the risks of pathogens and diseases that will impact on your health and well-being. Next slide, please. And food. So obviously, where we source our food, whether it's locally or from global supply chains, it has an impact. And we've already seen with climate change in other countries that actually our food supply chains are not necessarily so resilient. And what that does is not only sometimes introduce scarcity, particularly of those healthy foods that, those salad and vegetables and fruit that are so good for us, but also increases their prices. And we know with the cost of living impacts as well, is that actually people just simply cannot afford to eat, to buy healthy food in those kind of circumstances. And that then fuels the issues around excess weight and obesity, which again produce long-term health problems. So one of the issues that we need to tackle in Oxfordshire as an agricultural county is how we can increase the resilience and sustainability of our food supply chains. Next slide, please. And the final area that I wanted to look at was around nature and the opportunities, the impacts of climate change on our green spaces, on our green infrastructure, and access to nature is incredibly important from both a physical health but also a mental well-being perspective. And we know that if people connect with nature, then it does them good. Whether our green spaces in Oxfordshire are a source of are a benefit both to health and to climate adaptation depends on whether they act as a sink or a source. And because of a source of pollution and emissions, and because of the sort of intensive agriculture that exists in a lot of the county, it's currently more of a source of carbon emissions as opposed to the sink that it could be. But that's something that we're trying to change. So if we have the next slide, I think we're going to now move on, and Sarah's going to talk a little bit about what we're doing now.
Thank you, Rosie. So the report is trying to paint a picture of as Rosie said, the sort of prize of the short-term health benefits we get from some of the activity that's happening in Oxfordshire to combat climate change. And we've picked up five particular themes in the report where we think that's most prevalent. I'll just run through some of the activity, but obviously the report is there for people who want to read in more depth around it. So particular focus on energy efficient and healthy homes and buildings, and Rosie's picked up a bit on sort of the vulnerability, particularly of people experiencing respiratory disease or the elderly and the young, with damp homes, cold homes, and both now excess heat in the summer and winter cooling of homes. There's a lot of activity in Oxfordshire around this, ranging from advice through the Better Housing, Better Health service that's been running for a number of years, supporting residents, particularly on low incomes or with health conditions, on advice and access to funding where it's available. A number of programmes run by the County Council and more money coming from central government into these, which is welcome, although not yet at the scale really needed to meet the challenge. Allowing us to offer funding to those homes on particularly low incomes, and Dale may talk a little bit to that at the end of this call. And also the council putting in place a loan scheme to schools to allow schools to look at some of the retrofit of their buildings. And there is really quite extreme need in some of our schools, particularly around overheating in summer. And of course, there's a lot of community-led activity in this space, some community partnership around innovation, and a lot of activity happening in Rose Hill in Oxford in that space, but also community-led activity, giving advice on measures that can be taken to reduce energy demand in homes. On air quality, again, a similar picture. the county have responsibility for transport, so our leading initiatives are sort of very policy based around things like school streets, restricting vehicles at peak times of school travel, which of course is reducing pupils' exposure to pollution, but also trying to create an environment that encourages cycling through greater safety on the streets at those times. Public-private partnerships such as what's been referred to as the Zebra initiative, the zero emission in buses that are coming particularly into Oxford now. About 2/3 of those 160 zero emission buses are now on the streets, and obviously having an immediate effect on air pollution in that environment. And again, plenty of community-led activity in this space to encourage walking and cycling, and examples of that would be some of the community-led bike repairs and bike libraries type activity we've got. Rosie mentioned the strong links we have with the health and social care sector already, and of course they're large asset owners in their own right. £30 million awarded to a cohort of health services last year to decarbonise their sites. But lots of work happening in that space on access to nature, access to green spaces, particularly given the health benefits and mental health benefits Rosie's already picked up on. And we've also highlighted two final areas around green space and food. County Council have been given a new statutory role as convening a local nature recovery strategy, which is taking place across this year, and a number of people will have come across. Really good chance to input into that in coming months as the first stages of that are published. And again, a lot of community-led work in improving access to nature and even in sort of urban settings around pocket parks, etc. And just to sort of pick up lastly on food, Rosie talked about issues of resilience in terms of access to food. Lots of exciting work happening under the Good Food Oxford banner there, and particularly their work at the moment to pilot shortening supply chains and using more Oxfordshire produce within the county. I'll just go on to the next slide very briefly, please. So I think sort of sum that up across the last slide, really, that the report's trying to paint a picture that many people are participating across the actions that are needed to deliver these outcomes for climate and health at the moment. And that's happening at a range of scales. In Oxfordshire, of course, we're particularly blessed, I think, with people's commitment and mandate around this agenda, both on the health side and the climate action side. I'll hand back to you, Rosie. Thank you.
Fantastic. So I'm going to speed up a little bit because I want to hear from some of the local community groups themselves. So the call to action is a call to action to everybody locally in Oxfordshire. There's we've taken the opportunity to call on the national government to do more, and then there's an opportunity for individuals to take action. So next slide, please, Catherine. So the system actions cover 6 key areas. So one is around improving air quality by promoting active and sustainable travel and using low carbon transport to address that. We have a whole range of activities. We need to increase access to green spaces and to nature. The third area is around our buildings and estates and decarbonising those and ensuring that our homes are also sustainably heated. The fourth area is about looking at the supply chains and really supporting those organisations that supply us and support that delivery of net zero targets. Fifth area is around partnership working, which is this is a key element of, and 6 is incredibly important, which is about building community resilience, in which everybody's got a part to play. So those are the sort of 6 key areas that we're asking all partners to step up and support. Next slide, please. The call for national policy and funding mirrors very much what we've asked for support in terms of locally, because we know that whilst we can do a lot of things locally, many of the influences are at a national as well as international scale. I won't go through those now. Next slide, please. And then the call to action is really pointing people to look at the Climate Action Oxfordshire web platform, which gives people lots of really practical ideas about what to do. And it signposts some people to resources that address eco-anxiety or climate anxiety, which has been identified as a particular issue for some of our young people. Next slide, please. So key messages that I'd like you to take away is that, one, health impacts of climate action are immediate. Next slide, please. The actions we take will immediately improve our health, the health of others, the health of our communities. That in itself is reason for action. Next slide, please. And as a sort of a county council or as any organisation, frankly, we need to be really cognizant that if we are taking climate action, we need to think about what the benefits are to health and well-being and articulate them. And likewise, from a health perspective, we need to think about how we're delivering care, what those care pathways are, how we use those medical devices so that we reduce and prevent the negative impacts on climate and climate change. Next slide, please. And so in terms of taking forward the report, we are obviously working with our partners to try and engage as wide a range of people with the findings and its recommendations. There will be ongoing work with our NHS partners to ensure that they do deliver the targets in their green plans. And working with other districts and city councils as part of Future Oxfordshire Partnership to again support the delivery of a route maps for the zero carbon Oxfordshire. So a wide range of opportunities for people to get involved, but also really importantly, an opportunity to engage with communities and understand how you're contributing. So Catherine, I think that's probably all for now. Happy to take questions at this point or to hand over to our community partners who are going to talk about a couple of examples of how this is being put into action.
Yes, thank you, Rosie and Sarah, for that. I think really interesting. And again, from sort of when CAG, we were thinking about this conversation, I think, you know, that the slide Sarah talked through and people moving into that upper quadrant. And so the, you know, the idea that more communities are going to move into that space. And for us then thinking about not just climate action, but climate justice, and how can we be encouraging that around the network, and as an organization ourselves, how do we prioritize that and give capacity to that? And so I think this, yeah, the presentation, the report really sort of outlines that, the need for that. So thank you both. If people do have questions and you don't want to lose them, why don't you put them in the chat? I'm conscious of time and making sure we hear from everyone. Laura, are the RBUS folks on the call?
Yeah,
Great.
we've got, thanks, Catherine. So it was a fascinating report, and I think there's so much there that I'm going to keep going back to so that I can really keep it at the forefront of my mind about how these things really do intersect. And I think that the time is over for us to see climate as this topic of interest for people. I think we have to start embracing it into every aspect of what we do, and that presentation really brought that home. So I'm really thrilled to be joined by Ken Caldwell from an organisation called Arbus Spartans, and we're going to start off with a little question just for Ken to tell us a bit about Arbus Spartans. So Ken, are you unmuted and ready?
I think I'm unmuted. Can you hear me?
I can. That's fantastic.
Very good.
So welcome, Ken. Thank you so much for joining us. Do you want to start off by just telling us briefly about Arbus Spartans?
Sure. Yeah, we're a very small organisation. We're a management team of about 8 people and 11 volunteer drivers. And we set up Arbus Spartans in 2016 when Oxford County Council removed the subsidy from the then S4C stagecoach service, which ran through the village, leaving the village without any public transport at all. So we set that up in about 6 months, and we now provide it, well, from the start, we've provided a timetabled service, proper formal bus service open to anybody, 5 days a week, and once a month on Saturdays to the Dedington Farmers Market. Most of our passengers are elderly, as you would expect, and they've got no other means of transport, so otherwise they'd be stuck within Middle Barton or the local villages. And our services run basically out of Middle Barton through the local villages, and we serve places like Kidlington, so you can go to Sainsbury's or Tesco's or other supermarkets are available. Chipping Norton, Bicester, Banbury, and obviously most people use us for shopping, appointments at doctors, opticians, now banks. And we do run 2 services in the morning, early morning, and 2 services in the evening to Hayford Station and to Steeple Aston to connect with the trains into Oxford and Banbury, so people can use it for that as well.
That's fantastic. Thank you, Ken. And I think just even in listening to you there, I'm ticking some of those boxes that Rosie had in that slide about making sure that people in perhaps less well-connected areas can actually access shops to get fresh food, that people can have a link on to other forms of sustainable public transport. So I think, you know, already what you do is bringing so much up. So what you haven't mentioned yet is something about a recent success that you've had, although I know it was a long time in the making, but you secured funding from the National Lottery to actually purchase 2 electric buses. And how much of a role did thinking about the need to address climate change and move to electric make, do you think, in the success of that project?
Quite a lot, I would say, Laura. Yeah, I mean, we're running and still running 2 diesel buses, and we needed to put a fundraising campaign together to replace a bus. At that time, just 1 bus to minimise the fleet and try and keep the fleet up to date and minimise the maintenance costs. But from when we started in 2016, we've always wanted to. Would have loved to have gone electric in those days, but there's just no point. There were no buses available. We couldn't afford it in any case. We hadn't got any track record. No one would have backed us on that, even if anything had been available. So, but we did want to go electric. But this time, when we thought about our replacement this time, we thought we should actually aim high. It would have been easy to do another request for another diesel bus and carry on, because that's what people would have expected. But we wanted to go electric. We wanted to see what the response would be from our funders. We ought to go for it because we believe we should shoot high. That's how we got into the business in the first place. No one thought we could do it. So we got the bus service up and running in 6 months. No one thought we could do an electric bus and go for an electric bus, but they're arriving next week. At that time as well, we were doing quite a lot of private hire work for the local school, Middle Barton School. And so we were talking to the children about what we were doing, and they got heavily involved. They really did. And they almost sort of overtook the start of the thing by writing to the local politicians. They took it on as a huge project within all by themselves. We didn't talk to them about anything except the fact we wanted to go for a new bus and a new electric bus. And they wrote to the politicians. They made presentations for us at the funding to make sure, because they felt it was so important that we should be looking at electric rather than diesel, and we shouldn't be polluting the environment in the future. And it's their future, and they wanted it, and they saw it. And we also thought it was a great idea for us as well, because if we could do it, it would show the children what could be achieved if people really put their mind to it. And so, although, you know, we have a very, very minor impact on climate change, if we are running the bus, it's not going to make that much difference. It really isn't. But we wanted to show it's possible for a small organisation to do it. We wanted to start. We saw millions of pounds going towards Oxford, as you said, Oxford County Council, to run buses. 159 buses in Oxford are now electric. Well, will be 2 of our buses out of the 4 from next week will be electric, and we'll be running on that. So climate change was very much at the forefront of our thinking then, and we also wanted to really try and push for those buses. So we were very lucky to receive funding from the National Lottery Community Fund for that. It turned out to be 2 electric buses because they were the size that we wanted, and actually we couldn't have gone for 1 because there wasn't a bigger one. So they're slightly smaller, they're 11 seats instead of 16 seats, but that doesn't matter given the amount of people that we pick up on there. So climate change definitely did make a big difference, a big impact on our thinking, and I believe on the way the National Lottery saw us as well.
Thank you so much, Ken. I'm not going to quiz you anymore because we want time to hear from Cherwell Collective as well. But I think it's so inspiring what you've done. I mean, it was inspiring getting the bus company up and running in the first place, but then, you know, developing that proposal. And I think the National Lottery said at the time that you were the first community bus service to go electric. So to have that in Oxfordshire and to do it all on your own is just a massive achievement, and I think it will inspire other people. And I know you said it doesn't make a huge change, but I think that, as you say, the impact on a community seeing what you're doing and seeing what can be possible and people making those collective changes is really impactful in itself. So thanks so much, Ken, for everything. And if anybody can get out to the Bartons, then go and have a ride on any of their buses, because
Absolutely.
Electric one's special, but you know, it's actually really exciting to get on a community bus and have that experience of hearing from people that get on there about how much it means to them to have those services.
Yeah, and the timetables are all on the web, and you can do it through Google as well. If you look there, you'll see our bus services appear on when you're trying to plan your journeys.
Wonderful.
So,
thank you, Ken. Right. I'll hand back to Catherine. Thank you.
Great, thank you so much. Well, I am proud to introduce and welcome Emily Connolly, who is the founder and director of Cherwell Collective. Emily, thank you for joining us. Could you tell us a little bit about Cherwell Collective, and specifically about the evolution of the Waste Innovation Station Hubs, or the WISH project that you all have been moving forward over the past 2 years, I guess?
Yes, thank you for coming, Ken. Your work is really inspirational, and just like you, our work is based on everyone understanding that if we all do the little minor changes we can, then we come together to make really big differences. So Cherwell Collective is a group that started during COVID, working to try to improve individuals' sort of lot in their own supply chains, using surplus to top up, keep people inside their homes during COVID, and support with the public health goals. Then we also encouraged people to have a hand in growing their own food through a group harvest at home. You may have heard of Cherwell Larder, which was our surplus distribution unit. And we had Climatarian Kitchen that did outreach around the benefits of tightening those food supply chains and eating a more plant-based diet. Waste Innovation Station is a National Lottery funded project that had a pilot stage for 2 years. We call it WISH. It's a huge partnership, including CAG. We work a lot with public health and any group that wants to be a part of it, because it's really important to have a variety of views. And that was a way to take kind of the food work we had done during COVID and really test our model of breaking down barriers to individual agency and understanding what can support individuals to do the wanted behaviors when it comes to reducing waste and decreasing the consumption behaviors that cause climate change. So we do a lot of work in our pilot. We discovered that there are 2 main factors driving people's behaviors and individuals, their behaviors when it comes to doing the desired things of reducing waste and decreasing sort of excess shopping. And that's being connected to nature and being connected to other people. So during our full award, which has started now, we're really trying to use those connections, connecting people to nature, connecting them to one another to reinforce waste reduction and reducing consumption behaviors across Oxfordshire, and identifying other barriers to change we see in that work. So I don't know if you had more questions that's our little intro, or I can kind of just keep talking.
Well, so in thinking about how you got to, well, now that you sort of have identified those as two barriers, how are you then thinking about how you actually, because yeah, you're all sort of about changing individual behaviors and getting people to think about. So what are you thinking about or doing or hoping in terms of actually moving people along as it relates to those two things or other things?
So the idea is that we're really trying to increase infrastructure and opportunity for people to do the behaviors that we want. And that means pop-up hubs, pop-up larders. We'll be actually trying to try some pop-up larders in areas of deprivation that were on that lovely and kind of scary chart. And the pop-up larders we also try to have take place in green spaces. And the idea is that we provide we say come for the food, stay for the revolution. But the idea is that we provide surplus items that people will come for because they're low cost or free. And then in that space, we also provide access to other services and support in breaking down barriers to individual climate action. And then we encourage people to come back and be a part of the green space work, or get them involved with some of our other partners in the wider WISH partnership, like HAG and Wild Oxfordshire, and try to just sort of reinforce activity anywhere within the partnership, because we know it will reinforce these connections to nature and connections to one another that are so important. And through that work, we have observed that there are quite a few personal barriers for individuals when it comes to sort of doing the right thing for climate action, in particular, the vulnerable that we work with the most. So these are things like literacy, understanding what is the right decision, people who live on the estates feeling like they're completely helpless to do anything about energy improvements to their home, insulation to their home because of their financial situation. And then people feeling like doing the right thing for the climate impacts their personal choices, especially when it comes to dietary choices, asking people to reduce their meat intake because they feel like that's some choice they actually have control over, and it's a treat when they can't afford the meat. And so then we try to encourage them to make better exchanges. For example, we work with local farmers who use wild venison. You know, they need to remove these invasive creatures. And so we supply that wild venison and talk about the health benefits of it relative to beef, and then encourage people and even sort of teach them how to cook this wild venison so that they can replace the lamb and beef that are more costly to the environment with that exchange. And we have the venison priced comparably to our local shops. In terms of energy, we also provide community cool and warm spaces. And this is, again, a way that people can come into these spaces. That's reducing their costs at home. So that's kind of the like hook that brings them in. But then while they're there, they can connect with one another around reducing waste, around changing their consumption behaviors, around increasing their carbon literacy through activities that don't involve needing to read. And then they can sort of become empowered to do the right thing for the climate together and use that infrastructure. And we're hoping to take and starting to test those pop-up units all over the county so that we can take those services to other people. We also operate in Cherwell, which has a lot of rural areas, including the Bartons. And so we try to take those activities to people rather than forcing them to find transport in. And I would say one of the biggest lessons we learned from the pilot was that over the course of 18 months, as we reduced feeling these barriers, these financial barriers, and like they couldn't make any choices for people, but we reduced these barriers to individual climate agency, we also saw a serious increase in well-being in the same individuals. And I think that's a very important health concern that sort of goes beyond the obvious cleaner air, cleaner water, all of those things, is that when you reduce that eco-anxiety by actively supporting infrastructure that helps people have a role in kind of supporting their own climate justice, you have major well-being gains that are sort of above and beyond what you would get by just feeling better physically. So I'd say that's kind of the main shtick.
No, that's great. Thank you. I mean, I could listen to you talk about this on and on, but in the interest of making sure that everyone gets a chance, so I think we will go into breakout rooms now. I think we'll just do 2. And what I would love to do is, so 2 sort of questions to guide you. So whether you're here as an individual or representing a community group, an organization, a town, parish council, what do you think you might be doing in this space already that you think is interesting and would be interesting for others to hear about? And what would be the enablers to help you sort of, integrate maybe the climate and public health narrative more effectively or at all? And or sort of what might be the barriers in that? And again, thinking about this at different sort of levels, so individually or sort of systematically or systemically. So I will try and break us into those rooms now. I've got 40 seconds. There we go. Great. Welcome back, everyone. Laura, I will, hopefully you got started with a good discussion. Realize it's not enough time to necessarily get to sort of full conclusion of the next steps. But Laura, I'll turn it over to you to kind of, wrap us up for the evening and see where we've gotten to.
Fantastic. Okay, thank you, Catherine. Do you want me to share a little bit about our group and then okay. So we had some really interesting conversations and also a really interesting mix of people, which I think is really encouraging for this session, that we've had such a diverse range of people. On the first point about sharing some of the work that people are doing, we talked about some really practical hands-on things like thermal imaging of homes and supporting people to undertake that activity and then make changes to their homes. But then we got on to, I guess, the kind of broader topic of how valuable social infrastructure and then physical infrastructure is for people to be able to come together, have meaningful conversations, and then take action. So we had Emily from Cherwell Collective in our group talking about the impact of their place-based and pop-up activities to have those conversations. So drawing people in, as Emily touched on, with items, but then having those conversations. And then we also heard from another organisation about, making things fun and, a carbon footprint game and engaging people that way, which was fantastic. And then for the enablers and barriers, something that came out really strong was a whole discussion about town and parish councils, and a lot of town and parish councils that perhaps had declared a climate emergency, but were looking for support to actually be able to start making some practical changes and feeling a little bit lost and isolated, or residents saying that they were finding it a little bit hard to get some action from their town and parish council, and how might be the best practical way to start that conversation without feeling like you're putting this massive ask on them that they don't know where to go with it. So that came out so strong that we thought that actually supporting people and town and parish councils around that could be a really important thing. So yeah, it was a really good discussion. It felt like we had some really interesting ways to move forward and next steps as well. I don't know if anybody from the group wants to add anything that I missed.
Great, yeah, and I can summarize briefly for ours. So we also very much talked about that place-based model and the sort of needing the carrot to get people in, and how do you just sort of the tension between trying to have those local, authentic, meaningful relationships that bring people in, but also then needing to do that at scale. And so sort of, how do you do that in the most efficient way, where each sort of community group around the county is not necessarily recreating the wheel, but recognizing that it is those very local relationships that are what's going to sort of continue to drive this work forward. So it sounds like quite similar in that way. I don't know if anyone else wants to add anything else from our conversations. Probably an oversimplification, but for the purposes of time.
Great. And then are we gonna do our resource slide, or did Dale want to come in?
Well, I'll put it up, and so then Dale can speak to it. I think the other thing is, so we'll talk about resources. So either while you're looking at this next slide or afterwards, I think we wanted to see sort of, from this conversation, if there's one kind of action or commitment that you might want to take coming out of this conversation, either something that you heard, something that's inspired you, something that you've been thinking about and could use support from groups like CAG or OCVA, potentially, county district councils. So if there is something, put that in. We'd love to see that in the chat, and hopefully again sort of inspire additional ideas. Sorry, now let me figure out where this slide is. Bear with me. You're all going to be very underwhelmed by the slide once you see it, but here we go. There we go. So Rosie or Sarah, I can't remember, mentioned the Climate Action Oxfordshire, which again has so many good ideas for sort of individual actions people can take. There are other groups, again, sort of in that network support type function, like Low Carbon Hub, I'm sure many of you are familiar with, that deal with energy. And then also on energy, I will now turn it over to you, Dale, if you want to say a bit about the new app that you all have been working on or will be promoting soon.
Yeah, thanks, Catherine. Yeah, just to very quickly say that hopefully in the next fortnight, after the general election, we will be launching an Energy Saver app. You can see the link there, energysaverapp.com. And our hope is that this far more widely engages across the residents of Oxfordshire, because the particular retrofit schemes that we have are absolutely fantastic for those eligible, but the eligibility criteria is quite tight. I have to say, a bit of a call to action. Please do continue to try and identify those people who are likely to be eligible, because, for example, for the Home Upgrade Grant Scheme, it's up to £39,000 worth of work, so it's really significant. A whole house approach can be taken, and not a sticking plaster approach, but a real kind of long-term solution. So yeah, residents under £39,000 household income, low energy performance certificate of a D or below are eligible for that. But the app, the eligibility criteria there is essentially Oxfordshire resident with at least an electricity smart meter. So again, that won't include everybody, but we hope that for community action groups and for parish councils, I know there's a number on the call here and things, this is a way of encouraging downloads, and that the app itself will provide fantastic insight, sort of AI learning based on the half-hourly smart meter data, to provide really simple tips as to how to save energy, and typical savings as sort of 8%. So about £200 a year, £210 a year on average. And also the app provides a really interesting foundation that we can start to test exciting things to come. I won't say more now because I don't have time, but yeah, and if anybody wants resources, flyers, little business cards with the QR code to scan that takes you to the App Store, even a pull-up banner, things like that, please do get in contact with me. I'll just quickly put my email address in the chat. But thanks, Catherine.
Great, thanks, Dale. And then, the last thing I was going to mention, the climate action team within the county. There's a new position on. It's I think a community climate position, so sort of that engagement piece. And so there's a consultation survey out right now, and I'll send this slide around, which has the link for people to input into what the county's climate engagement strategy looks like. And I think, again, as people have ideas and are interested, it would be great to input into that.